Hey, this is Dr. Paul Thomas with Startup DPC, and a lot of doctors ask me how we get really good prices on our laboratory and radiology services, and it really comes down to being super persistent with your effort to lower the cost of care for patients in the community. So ultimately, when you lower the prices on your lab work, you're saving patients and real people in your community a lot of money. And so that's why it was really important to us to get the lowest prices possible for our patients. And so let's start with radiology. We use a radiology service called Regional Medical Imaging. They actually have a PDF online with all of their prices, and they deliver it to us. So whenever we want to order a test, we can either fill out a paper form or fill out a form online that gets digitally sent to the company. And our patient is able to get a great service, the radiology service with the reading, for a really low price. For example, the chest x-ray is about $40 for an AP and a lateral view. The ultrasound of the abdomen is about $150, $160. Pelvic ultrasound is about $130, $140. A CT of the abdomen and pelvis is about $460 because they're going to use contrast with that one, so it makes it a little bit more expensive. Let's do an MRI of the brain is about $300. And so these services that could be thousands of dollars, like a brain MRI could be $3,000, it's now $300 because we've negotiated with a local company that has the pocketbooks of our patients in mind when they offer these services. The great thing about this company in particular is that I can call the radiologist and have a conversation with them about the study, and we can talk about what's going on clinically, and we can kind of have a discussion about our mutual patient. And that's really important to me as well. The other thing that we do is we draw blood in our office, and we use a company called Quest. So we have got a little lab caddy here. We use these tubes to get virtually any lab that we need to get. We have this little handy sheet from Quest. Most of our labs are going to the red top tube or the lavender top tube. And when we first approached Quest maybe 4.5 years ago, the prices were terrible, and we had to do a ton of negotiating to get them down to where they are now. A comprehensive metabolic panel might be $150 at the hospital, and our patients at our clinic pay about $6. HIV test, again, might be $100 at the hospital, and our patients pay about $10. And so it's really important to us to lower the cost of care for our patients. And one of the ways that we do that is by getting great lab pricing for our patients. If you want to read more about this, I write about it in my book, some of my negotiation strategies. I also wrote a fresh blog post today, so check out our blog. It's on startupdpc.com. And if you pick up my book and you want to leave a review, it goes a long way. So thanks so much for reading and watching, and have a great day.